Data from Israel's health ministry shows Pfizer's COVID-19 vaccine significantly less effective at preventing infection and symptomatic illness with the Delta variant than previous strains of coronavirus, conflicting with existing research that suggests strong protection against the variant, and here's what might explain the discrepancy: 0.93%. That's how effective the Pfizer vaccine is at preventing serious illness and hospitalization after 2 doses, according to the Israel study. This is only slightly lower than against other variants. When you look at it, that means the vaccine is doing its job really well, Strain said, given this is the key purpose of a vaccine. The downside, however, is that we may start seeing the virus spreading again. I am afraid that the current Israeli Ministry of Health analysis cannot be used to safely assess it, one way or another, tweeted Uri Shalit, a senior lecturer at the Technion, Israel Institute of Technology, pointing to numerous confounding variables the study did not account for that could explain the results. The study did not, for example, consider the potential differences between vaccinated and unvaccinated people, Shalit said, who might differ in their willingness to get tested for COVID-19 or adherence to public health guidance like social distancing or mask wearing. Weintraub, who is also a professor of medicine at Brigham and Women's Hospital, told Forbes she agrees with this assessment, though stressed that other studies indicate the vaccine is still highly effective, and reinforced the importance of the second dose to fend off the Delta variant. The infectious Delta variant has driven new waves of COVID-19 in countries around the world, including highly vaccinated ones that had already managed to control the virus. Many, including parts of Europe, Israel and Australia, are reinstating restrictions and lockdowns to contain outbreaks, while others, notably the UK, are preparing to just live with the virus, a strategy many scientists have branded as dangerous and woefully misguided. Over the course of around 2 months, the variant has gone from accounting for practically no US cases to being the country's dominant strain, making up as many as 80% of cases in some areas. Given the country's uneven vaccine coverage, experts are worried Delta could undermine American efforts to manage the virus, especially with practically no pandemic restrictions left in place. Given the variant's resistance to vaccines and high transmissibility, the potential use of booster shots to top up waning immunity has become a contentious topic among experts, officials and pharmaceutical companies. Pfizer, citing evidence of waning immunity, is pushing regulators to approve its booster shot. Israel's regulator recently approved it for immunocompromised individuals. US regulators rejected this approach and said fully vaccinated Americans do not need a booster shot at this time.